Hello, hello. My name is Jones, and I welcome you to this part of surgery, where we are looking at the management of a patient undergoing surgery. Within this lesson, we are going to look at the peri-operative care of the patient. Peri-operative care involves pre-operative phase, intra-operative phase, and post-operative phase. Each surgical client responds differently in surgery when they enter the healthcare setting in different stages of their health. Many variables influence a person's physiologic and psychological response to surgical experience. These may include the physical, mental status, and also the extent of the disease, and also the magnitude of the surgery, the social and the financial resources, and not ignoring the psychological and the physiological preparation that is needed for surgery. So all these may affect the patient respond in a certain way to surgery. So these variables review the degree of risk for a client undergoing surgery, and nurses are going to use all the phases of the nursing process within the peri-operative phase. That is to do within the pre-operative phase, the intraoperative phase, and the post-operative phase, so that they make assessment and provide interventions that are necessary to promote the recovery of our patient throughout all these different phases of the peri-operative care. So peri-operative care is a term that has been used to describe the care that is given to a client before, during, and after surgery. It takes place in hospitals, in surgical centers attached to hospitals, in freestanding surgical centers, or healthcare provider offices. Peri-operative period is the period extending from the time of hospitalization for surgery to the time of discharge of the patient. The goal of peri-operative care is to provide a better condition for patient before operation, during operation, and after the operation. So, as earlier indicated, peri-operative care has the pre-operative phase, the intraoperative phase, and the post-operative phase. In place of phase, we can still say pre-operative period, intraoperative period, and the post-operative period. So when we say pre-operative period, this period begins when the decision for surgical intervention has been made and ends with the transference of the clients to the operative suite. Nursing activities within this period range from baseline assessment of the client during the pre-operative interview, and then continues with assessment in the pre-admission unit or induction room on the day of the surgery. Before surgery, the nurse is going to prepare the client and family for the surgery, perform diagnostic test, and also assess the client in readiness for the operation. So pre-operative phase, that is all the preparations that are done before the patient is taken to theater, is what we call the pre-operative period or phase. Then the intraoperative period, this is the intraoperative period that begins when the patient is transferred to the operating room, and ends when the patient is transferred to the post-anesthetic care unit, which is abbreviated as PACU, the post-anesthetic care unit. During this period of intraoperative phase, the patient is monitored, anesthetized, and dripped, and the operation is performed. Nursing activities during this period focuses on maintaining the safety of the patient, preventing infection, and also helping to see that the physiological response of the patient to anesthesia is appropriate. Okay, so after the operation has been done successfully, Then the patient is taken back to the post-anesthetic care unit. Okay, so the post-operative period begins after the patient has been taken to the post-anesthetic care unit and terminates with the resolution of the surgical sequel. It is quite common for this period to end outside of the care of the surgical team. Okay, so post-operative phase or period, we're just looking from the time the patient is formally discharged from theater up to the time the patient has recovered from the condition without necessarily sequel of the disease, or we are saying with the resolution of that sequel. Pre-operative nursing care. Okay, so as part of the perioperative, we have the first one, which is the pre-operative nursing care. Okay, so this lays the biggest foundation for all the care that we give to surgical patients. Okay, so it is important that we know what generally has to be done in the pre-operative phase. And if you are a theater nurse, it's important that you understand and know what should be done in the intraoperative phase. Okay, so then if you're a general nurse, again, you should know what should be done in the post-operative phase if you are working in the surgical ward. Okay, so pre-operative phase can be simplified to say we have the planned pre-operative nursing care, okay, that has 3 phases of preparation. These may include remote preparation, and remote preparation, these are activities that are done that is weeks before the 12 hours before the operation. Then we have the immediate preparation, which happens within the 12 hours before operation, and it applies to both elective and urgent surgery. Then the other phase of the planned or elective pre-operative care is the final preparation, that is on the day of surgery. Okay, so that is how we can break down pre-operative nursing care. Okay, so in the pre-operative, the remote, mostly we are looking for selective surgery that will be done sometime 12 hours before, okay, sometime like it has been arranged that this surgery will be done. So all those preparation that needs to be done, if the patient had low weight, that is to stand surgery, okay, the patient will be required to gain weight so that they can gain the surgeon's preference of weight, which can help patient respond to the stress that comes with surgery. Okay, so if patient had problem with hypertension, okay, so that needs to be corrected before the patient can come to theater. So all this can be done in the remote preparation, but in the 12 hours before operation, we are calling that the immediate preparation. Okay, here we are looking at the operation, and applies to both elective and urgent surgery when you now physically need to prepare the patient for this. Then in the final preparation, that is the day of surgery, here we are just looking at emptying the bladder, okay, bowels of the patient, and putting identity and putting in all those things. Okay, that is the final preparation before the patient actually goes to theater. Okay, so pre-operative nursing care can be simplified in some alphabet letters, that is A, B, C, D. A, B, C, D mostly applies to emergency pre-operation. Okay, so A, B, C, D can apply to emergency pre-operation. But when you talk of A, B, C, D, E, F, G, H, I, J, then N, P, O, this can now then apply also to general cases. So why we are saying A, B, C, D applies to emergency surgery, because in emergency surgery we need resuscitation. Okay, so in resuscitation you look at A for airway, then B for breathing, C for circulation. Okay, then D for drugs, the emergency drugs that you have to give. If we are looking at it as a general case, then we are looking at pre-medication. Okay, so there are pre-medications that are supposed to be given. Okay, so this is the A, B, C, D in the emergency part. So pre-operative may have emergency care, okay, and then may have the general care of the patient. But in our breakdown here, we have said we have these phases of remote preparation, immediate preparation, and then the final, because we have selective cases and then we have urgent cases. So in urgent cases, there can be emergency preparation of the patient. So you need to secure the airway, breathing, and the circulation. Since we are talking about pre-operative nursing care, so C will not just be for circulation, but it can also be a point to do with consent. Consent signing, we know it's 18 years and above, and that you can tabulate in your report, or it is something that you need to note. Okay, then A, B, C, D. D, we have said, is for drug, emergency drugs. So E is for elimination. Okay, so E is for environment. So in the pre-operative care, you have to ensure patient's environment that they will be received in. Okay, the beds that they will be received in. Okay, we talk about patient being admitted near the nurse's bay. Okay, this is for easy observation and the like. So such things may come in when you're talking about pre-operative care, and that is the E for environment. So you find that in our breakdown here, we might look at room. Okay, of course, we are looking at the environment. It's the one and the same thing. Then F, we're looking at fluids. This, to maintain circulatory volume, F, we're looking at fluids, and patient needs to be cannulated if the patient will go under general anesthesia. Okay, so fluids are quite important for a patient because they are going to lose some blood. Okay, so that is F. Then G is for gowning. So gowning helps to prevent infection. Okay, gowning helps to prevent infection because we give them a sterile gown. Then H is for hygiene. Okay, hygiene includes nail care, bathing of the patient, oral care, and all those things. They are very necessary for this patient in the pre-operative phase. Then the other letter that we can talk about in our alphabet pre-operative care model proposed by Mr. Jones is I. I for identity, I for investigations that are supposed to be done. Okay, identity is important so that we can read the information that is there. There are some certain details that are supposed to be on the identity band. The name of the patient, okay, the age and sex, and also weight. Okay, so for weight, it can help you to determine the amount of anesthesia that the patient is supposed to use. The name is important so that you know that you're operating on the right patient. Then J is for jewelries. So jewelries have to be removed to prevent electrocution and also blockage or aspiration. If a person has some artificial teeth that they have, so they can easily dislodge and cause blockage. So we're saying jewelries needs to be removed. Then the NPO, okay, N is for nutrition. In emergency, N, we can put an NG tube. This is to decongest the abdominal system so that you prevent paralytic areas, since the time to stop the patient is limited. Then P is for psychological care. Anyone who's about to go for surgery needs this psychological care in order to improve their readiness for the procedure. Then O is observation. So A, B, C, D, E, F, G, H, I, J. Then NPO is an alphabet model for pre-operative nursing care as proposed by Mr. Jones. Okay, then We will still look in the next part at power. Okay, that is for post-op. We look at power for post-op as a model. Okay, so power as a model just looks at pain management. Okay, it looks at prevention of infection, but otherwise I urge you to look out for that lesson and listen to it. Okay, on post-operative care. So in the remote preparation of pre-operative nursing care, of which we have talked about, remote preparation, immediate preparation, and final preparation. So in the remote preparation, that is weeks before, 12 hours before the operation, you have to prepare the patient both mentally and physically for the operation. Okay, and you have to treat or control existing conditions before surgery. If there is hypertension, you have to ensure that you treat or control it, so that it can reach a moment in which patient can withstand surgery. Okay, so in the remote preparation here, we are looking at room and rest. So patient will be admitted in a general ward or near nurse's bay for easy observation depending on the condition. Okay, and then the bed should be an occupied bed, or it will depend on the condition of the patient. Okay, so you have to position the patient in his most comfortable position or as dictated by the condition. Bed accessories such as drip stands and elevators can be provided depending on the condition, and the patient should be ready to use all these. You have to nurse the patient in a well-lit room, okay, and warm room, and also well-ventilated room for the comfort of the patient. Also nurse a patient in a quiet room, as this also promotes rest, and it will be achieved by playing TV and video, let's say, and TV at low volume. Okay, if you have some trolleys that make that squeak sound, you have to oil them, and then if you have phones that make a lot of noise, you have to put them on silent and promptly answer them. Okay, so that the room can be quiet and conducive for the patient. All nurses know this. Okay, so it is important that you know these interventions that are done, and like just knowing the title of the models that has been proposed within this presentation. Okay, then we can talk about psychological care. Okay, so in talking about psychological care here, we are saying explain the condition to the patient in simple terms for knowledge, and also update the patient on the progress on the treatment. You have to reassure the patient that as the medical team, you are doing everything possible to reverse the situation to normal. You have to explain about the environment at the theater and the hospital as well. Okay, for patients to be acquainted to the routines that are there, as it will also help to allay anxiety. If possible, you can send a well-treated case of a similar condition to the patient, so that they can help instill confidence in the patient. So this can be done for the patient, of course, if the patient is comfortable to hear testimony from people that had a similar problem and they recovered. Also, with permission, you can arrange for a clergy. Of course, this has to be from the patient's church of choice, so that they can come and give spiritual care. So all these duties as a nurse should not be neglected. So in the ABC model that we have proposed, it's not necessarily in some kind of chronological order. So that's why you're seeing these things flowing. So even these points, it's not that they have to flow in this same order, but you have to ensure that when you're talking about psychological care, the elements or items that are supposed to be psychological care are the ones that comes out in the psychological care. Okay, so it helps us to plan, to say, okay, what have we done for the patient in terms of psychological care? What have we done for the patient in case of nutrition? What have we done for the patient in terms of investigations or observation. So that is very important. So the framework is there just to help us, guide us, okay, so that we know some areas that are supposed to be tackled. It can still be expanded if at all you research more and feel there are certain points that need to be added. So in the pre-operative care here, we have looked at the room, we have looked at psychological care. Then the other important thing, please, when you are said, we are told management. So what will be the management of the condition? So when they talk about management, you talk about treatment, you also talk about investigations. After that, you go to nursing care. It is under nursing care where you come up with your aims for that nursing care. Before treatment and investigation, the aims are for the clinicians on what they want to achieve. Then for the nursing care, you are the one that is nursing this patient. So what are the objectives? What are the aims for your nursing care? So after you write your nursing care, then you write your aims. After you write your aims, then you go in the nursing care framework that you can use. Okay, so to do with investigation, I'm just going to highlight some general investigation that can be done since we are not looking at any specific condition. So X-ray can be done to exclude lung diseases like TB, pneumonia, and also exclude hepatomegaly, also to exclude cardiomegaly if patient has such a condition. Okay, so other investigation can include blood for hemoglobin to rule out anemia, and also need to do a cross match for any possible blood transfusion. Full blood count can also be done with ESR to rule out infections, and full blood count is done in order to see that the patient's immune system is just okay, based on the count of white blood cells and all that. And also the ESR can help us to detect if there are infections. Okay, so full blood count also in other settings, you know that it would also help you know the hematocrit value, okay, or to help you know the HB, so that in case there is a transfusion, you can do that before the operation can be done. Then urine analysis also can be done to rule out urinary tract infection, and also from urine, remember, we are able to test for diabetes, so you can also test for diabetes. Diabetes becomes very important to test for in any operation, because high sugar levels may affect wound healing, or diabetes may lead to poor wound healing. Okay, so depending on the disease that you are doing, please, or that you are looking at there, you can give specific investigations. Like if you want to do thyroidectomy, that is thyroidectomy, you have to do the T3, T4 for the patient to see the levels of these hormones. Okay, so treatment for existing abnormalities or conditions like dental caries, skin condition, constipation, diabetes, respiratory and cardiac conditions. Also, all these, you have to ensure that these are well managed before the procedure, or well controlled before the procedure, and that the patient is adhering to the treatment. Okay, this is to reduce on post-operative complications or intraoperative complications. Okay, so this patient in preoperative care also needs the attention to do with nutrition. Depending on the condition, you can give a food diet that is rich in carbohydrates, and it is important when you mention carbohydrates, you mention the rationale for giving carbohydrates, that it's for energy. Proteins, they repair worn out tissues, and then vitamins, they help specifically with improving the immune system, and also they help promote wound healing. Okay, so you can save food to the client in small quantity, and also save the food attractively, as this promotes appetite. Okay, This also depends on the condition of the patient, and some foods may be restricted in some conditions. So it is important that to take all this in consideration, because right now we are just looking at the general pre-operative care of the patient. Then hygiene assists the patient with personal personal hygiene and other related care to do with hygiene, like bathing and showering. Here, it can be done to remove excess body dirt and oils, and it gives the patient a sense of relaxation. Depending upon the extent of surgery, it may be several days before a patient may take a real bath. Okay, hair care should also be done for the same reason as bathing of patient, as it helps to reduce the dirt that the patient may have. Okay, so other things has to do with mouth care, that is to do with hygiene. Here, all operative patients should have thorough mouth care before surgery, because a clean mouth helps the patient to feel comfortable. A clean mouth promotes appetite. Okay, and if at all possible within the hygiene, you can also talk about changing of linen, okay, linen of the patient, as it is also a way of maintaining proper hygiene for the patient. You cannot have a patient using the same linen for 3-4 days or for 1 week. So you have to ensure that you constantly change linen as need arises. Okay, then in preoperative care, we talk about also patient teaching. Remember, in the ABC model or the alphabet model, okay, there is E for, in the alphabet model, there is E for elimination. E can also be for exercises. Okay, so the value of pre-operative instruction to the patient is very important. Okay, because it will also help reduce complications that may come post-surgery, and also helps patients to cooperate and know the expected outcome, or know about the expected picture after the procedure. Each patient should be taught, okay, as an individual in terms of his anxiety and need, and also hope. Patients should be taught post-operative exercises that will be required, okay. So this is to help them play a role in preventing complications. So the post-operative exercises may include deep breathing, exercising, coughing, and also moving of extremities. Turning in bed and early ambulation also helps the patient to maintain good blood circulation and also stimulate respiratory function. Okay, so you have to remember that during surgery there is a decreased movement of gases, okay, and there's decreased movement of food within our GIT that may bring about discomfort and constipation and predispose to paralytic areas. So patient really needs these post-operative exercises, okay, so that they learn about them. So patient can also practice before surgery other exercises that the nurses may see fit in order to psychologically prepare the patient for the surgery. In some instances, the patient may need special aids such as a pillow between the legs to help maintain body alignment. So this should be done for the patient. But otherwise, post-operative exercises also include deep breathing exercises, which helps to prevent complications like pneumonia, okay, post-operatively, or complications like atelectasis. Okay, so atelectasis, we are looking at incomplete expansion of the lung or portion of the lung. Texasis is seen as collapse of the lung. So in deep breathing, the patient should inhale and exhale as much air as possible, okay, and also should you need to explain the procedure and the purpose of the procedure to the patient so that they can cooperate and do the best exercises that they need to, so that we prevent complications. So deep breath as often as possible. Also, that is preferably 5 to 10 times every hour during postoperative immobilized period may help prevent hypostatic pneumonia, okay, that come because of inactivity of the patient postoperatively, because of the pain that they may have, so they may tend to be inactive. So that will lead to build-up of mucus within the chest, predisposing the patient to hypostatic pneumonia. Okay, so preoperatively on elimination, I can say give fluids as prescribed, monitor urine output. Okay, when you're monitoring urine output, you look at the color and the amount. So the amount, kidney problem you can note, and color, saturation of urine you are able to note. Then you have to monitor bowel movements. There could be constipation or diarrhea, and then if at all any of these is there, you can take the appropriate measures. Then immediate preparation, that is 12 hours before operation, that this is within the pre-operation stage. So in the immediate, when the patient now has been admitted in the 12 hours here, okay, or patient will be going to theater the next day. So in the 12 hours leading to the operation, then you have to ensure that the patient has signed the consent. So that is A, B, C, we said circulation, then C, consent. Okay, and we said it's only in emergencies that we talk about A, B, C, D, because those A, B, C, D constitute emergency to do with resuscitation. Okay, then from consent form, then you can look at observations. So vital signs such as temperature, pulse, respiration, blood pressure, and the patient's weight are very, very important. As when we talk about weight, it's used for drug administration. Okay, these are from the baseline data for subsequent assessments that may come. Alimentary tract preparation or GIT preparation. Remember, G, we talked of it as gown, but also here we're talking about G to say GIT preparation. Patients should be starved 6 to 8 hours prior to surgery. And then when you're talking about babies, they should be fasted for at least 4 hours. And the last meal should be a light meal before the patient starts the fasting. Depending on the type of operation, like gastrectomy, the patient may be fasted for 24 hours if you are looking at gastrectomy. Okay, so depending on the type of surgery, enema can be administered. If operation is on a colony, a high colonic washout with antibiotic solution can be performed. So we are looking at drugs like kanamycin, neomycin. These may be ordered and given. Depending on the condition and type of surgery, and a nasogastric tube may be inserted. The urethral catheter may be inserted, especially the pelvic and the lower abdominal surgery part. So you can apply that. Okay, then on skin preparation, okay, from our alphabet there, we have also skin preparation, which can still fall under hygiene. You can bath the patient, remove prosthesis, and also encourage shaving before the operation, or the shaving should be done before the operation. Okay, then what are some of the final preparation now in the last hour on the last day? You have to awaken the patient early on the day of the operation so that you can provide a theater gown. Should cover the patient's hair completely with a cap, and then allow the patients you can allow the patient to empty their bladder before asking the patient to theater. Label the patient and also insert intravenous lines for administration of drugs. Catheterize the patient if indicated or in major surgeries. The pre-medications that we can talk about here, I like talking about AAA antibiotics. Okay, then we talk about atropine if it's abdominal surgery. Okay, then apart from that, we can look at antipyretics or analgesia drugs there. So pre-medications are given to allay anxiety and decrease the flow of pharyngeal secretions to reduce the amount of anesthesia, and also given to create some amnesia about the event and follow and to follow the events that follow surgery. So and anxiety drugs that we are looking at. So drugs may include sedatives like phenobarbital, 60 to 90 milligrams. Okay, tranquilizer like Valium can be given. Okay, then antibiotic cover can be given or as prophylaxis. So you can take the patient's notes and x-rays and other documentation to theater so that the operation now can be done. Okay, so within this lesson, we are looking at management of the patient, okay, who is undergoing surgery. In this lesson, we have appreciated what happens in the pre-operative phase. We have also talked about the 3 different phases of the peri-operative phase or period of surgery. In the peri-operative phase, we have the pre-operative phase, the intraoperative phase, and the post-operative phase. Okay, and we have gone to break down the many things that can be done in the pre-operative phase. So we said the pre-operative phase as the remote preparation, the immediate preparation, and the final preparation. So we broke down these on what necessarily happens on the room and rest, what happens in the psychological care. Okay, because knowing what is supposed to be done within this framework is very, very important. So we simplified the framework as A, B, C, D, E, F, G, H, I, J, then NPO as the framework to use when we are talking about pre-operative care. So from me, I'm saying thank you and keep studying.